One of the sections is the sympathomimetic forms. You will be expected to describe alpha-1 receptors. Where do we find those? Alpha-2 receptors. Where do we find those? And that'll make more sense when we talk about antihypertensive forms. Which organs have beta-1 receptors? Which organs have beta-2 receptors? Can you describe the use of epinephrine for anaphylaxis, severe allergic reaction? Can you describe epinephrine for cardiac arrest? Why do we use adrenaline in cardiac arrest? Why would we use epinephrine in bronchospasm? Why is epinephrine added to lidocaine? Lidocaine is a local anesthetic, and sometimes we can add epinephrine to the lidocaine for a reason that I want you to be able to explain. Can you describe why norepinephrine is used for low blood pressure hypotension? Can you explain why dopamine is used as a drug in low blood pressure? Phenol Efrain is also known as neosynephrine. It can be used to treat hypotension, low blood pressure, but the same phenol Efrain that we can use IV for hypotension is the same phenol Efrain that we can squirt up our nose and use as a nasal decongestant, which is the same phenol Efrain that they'll put in preparation H and use on hemorrhoids. And so even though you would think all these are different drugs for different reasons, they're the same. It's the same drug having the same effect, just with different indications. So can you describe the effects of albuterol when we use it in an asthmatic? Salmeterol is just a long-acting form of albuterol, and it's used in asthma. Can you describe ephedrine? It's commonly used as a decongestant, as is Sudafed. Oxymetazoline is a longer-acting form of neosynephrine that they've put in nasal sprays. And so amphetamine is essentially acting, means it works on the brain as well as sympathomimetic, as is phenyl methylphenidate.